All right, how are we doing, Professor? I'm going to start off with the flexion and extension. I'm going to start off with the upper body. Humerus connected to the scapula. The important articulations in this regard are the head of the humerus connected with the glenoid cavity of the scapula. And then, with respect to the lower body, um, it's going to be the medial and lateral condyles on the femur, the distal epiphysis of the femur, connecting to the proximal epiphysis condyles of the tibia. Okay, so this is going to be extension, and then in regards to the lower body, extension, out, okay, and then okay, flexion, flexion, and then flexion, in. Okay, moving on to um, abduction and adduction. Uh, what we're going to be using here is the femur and the hip to represent this femur and the hip, and then uh, the scapula and the humerus. Um, so the articulations that matter are the head of the femur and the acetabellum of the pelvis. Connection between, I believe, three bones in there that's accumulates the acetabellum ball and socket region. And then the head articulation of the humerus articulating with the glenoid cavity of the scapula once again. Okay. Okay, so abduction, abduction, lower body, abduction, and then adduction, coming in, adduction coming in, and then starting out, adduction. So coming in, swinging the leg in, starting here, adduction coming in. Okay, so now we move on to rotation. We're going to do the rotation between the C1 atlas and the C2 axis. What's important here is the rotation around the dens that's located on the C2 vertebrae. Um, and then the inferior articular processes articulate to the superior articular processes on the C2 vertebrae. So the inferior articular processes, excuse me, inferior articular processes on the C1 articulate with the superior articular surfaces on C2. And then lastly, another articulation would be the superior articular facet. Again, articulates with the occipital condyles on the inferior region of the skull. Okay. Okay, so rotation. C1 giving us the ability to say no, rotate right and left. Okay. Okay, moving on to circumduction here. Once again, we're going to use the humerus and the scapula. So once again, it's the head of the humerus and then the glenoid cavity. That's going to be the articulations that matter. Glenoid cavity on the scapula. circumduction, around the circle. Moving on to pronation, supination. I believe it gets pretty complicated here. I wasn't quite sure if all the uh, superior and inferior carpals in the hand actually matter in the articulation of this movement, but it seemed as if they would. So the pronation and supination is quite complicated in regards to the bones that matter, I believe. So the uh, humerus, ulna, radius, and then the superior and inferior carpals in the hand, I believe, articulate with this movement. So for example, the body of the scaphoid, lunate, triquetral, pisiform, be the proximal carpals that matter, and then the distal carpals would be the body of the trapezium, the body of the trapezoid, the capitate, and then the body of the hamate. And then in regards to the articulations that matter for the forearm region, will be the trochlear notch articulating with the humerus, and then the head of the ulna articulating with the carpals, and then the head articulates with the humerus on the radius. The radius head articulates with the humerus, and then the distal epiphysis of shaft articulating with the proximal carpals. And then the trochlea at distal epiphysis of humerus. And I believe that covers the majority. So, supination. So, supination, holding a bowl of soup. Supination, and then pronation, conversely, the opposite way. Okay, so getting near the end, we're going to do dorsiflexion and plantar flexion. Okay, so the bones that are going to matter here are the tibia and the talus. I believe that's the only two bones that matter in this joint. So the medial malleolus and the inferior articular surface of the tibia articulates with the body of the talus. Okay, so dorsiflexion up, and then plantar flexion down. Okay, and then lastly we have inversion and eversion. So once again, it's what's the bones that are relevant are the tibia, and then the tibia and the talus. Once again. So the shaft of the tibia articulates with the body of the talus. Okay, so it's gonna be inversion, and then eversion outwards. And that's it. Hopefully my articulations and bones used are relatively what you're looking for. So thank you for watching.